8 months of this shit we've endured for nothing. 8 months of job uncertainty and going fucking mental staring at your four walls. 8 months of wishing your loved ones were, somewhere else. 8 months of the NHS being pushed to breaking point after 10 years of the government pushing the NHS to breaking point. 8 months of death. Lots of death. Not just old farts that were on their way out anyway. Death. This latest set of back-of-the-fag packet rules, isn't the government remaining fluid and adaptable to an ongoing and developing crisis. This is the government failing.
Huples cat. Haven't touched on the topic of COVID for a while because, frankly, there's not that much to say. I know a lot of channels out there that are focused on it, have their daily updates and stuff, and grab every single report, don't analyse the report other than what the report's saying, and then give you the information. So what I've been doing is I've just been basically reading a bunch of research reports and continuing the preps I suggested, and I'm still going to be continuing those preps. But I've noticed, and you probably have feeling it, a large degree of frustration going on right now. What's happening always is local. As Dad on YouTube always says, SHTF isn't real until it happens to you. And everybody's looking at a global pandemic through the lens of their own local, regional and national ideas. But what actually is going on, and I'm going to use the United Kingdom quite heavily in this video to show what's happening everywhere, because it's a good idea, because the United Kingdom is one of the worst per capita death rates and infection rates in the world. There's about 10 countries that are really bad. I'm afraid the United States of America is one of those, despite political denials. Per capita death and infection rate per capita. And that's what you really want to look at, right? But the issue is, why is every government in the world, left and right, doing stuff that some people are saying is lefty, New World Order control, and other people are saying is fascism and anti-freedom? The truth is that the statistics is pretty clear. There's still people, I had somebody on my channel today who actually has a YouTube channel who has influence because of that, hopefully to a small number of people, who is still maintaining that COVID-19 disease is just flu, that its death rates is just flu. And clearly it isn't, and you'll see quite a few statistics coming up both in this video and subsequent videos actually illustrating quite clearly that COVID-19 isn't flu. It's actually a coronavirus, so it isn't influenza, but its death rate is phenomenal compared to what we would see in an extremely bad flu year. So what I'm going to show now is a daily update report from my province in Canada, Ontario, where they collate some straight figures and put them up. Now remember, all the figures are from the previous few weeks and they're released on a certain date at 10:30 in the morning in Ontario's case. So when you see that, for example, Iran has had 300 deaths today, they haven't. They've gathered data from deaths over the last week or even months and have decided yesterday or the day before that those deaths were COVID-19 related. And then we get into a big problem. A lot of governments will only accept people that die in hospital within 28 days of diagnosis, or clearly only have died of COVID-19. Some governments, and I think some parts of America are still doing this, will actually not count people who die from COVID-19 who die from multi-system organ failure as a result of COVID-19. And so the figures that we're getting nationally and regionally are very much politically decided in what they're actually going to count. But when you look at baseline death rates, and that's what I've been saying all along since February, when you look at baseline death rates, COVID-19, directly or indirectly, is a mega killer. Now, when you look at the death rates in Ontario from people diagnosed with COVID-19, you'll see that it's about 5%. It started at about 6.8 to 6.3% during the long 3 months we had in Canada of stability in very few cases. So the actual stable death rate is, in my opinion, about 6.3% in a rich country with a functional intensive care service. About 6.3. So why is it now 5? It's 5 because our caseload's going through the roof. Now, compared to a lot of places, our caseload is still very low. It's only about 700 or so a day, which a lot of places with a population as large as 11 million as us would say is pretty good. England would love to have caseloads at that low They don't. There's a lot higher, as you will see. The interesting thing is, as we've evolved in our understanding of the disease, certain things that were known to be true, and I have told you are true, are not true. So first off, male-female gender. The male-female gender division with COVID-19 pretty much doesn't exist. It does exist above and below 65, but interestingly, on balance, it's fairly even. Men are slightly more likely to die from it and be hospitalised from it than women, but overall, the genders are actually equally at risk. And that's something we didn't know. The other thing is that it still appears to be that about 54-55% of everybody that gets hospitalised with COVID-19 disease would have described themselves in the previous 6 weeks as fit and well without a chronic condition. That's very important. The majority have no pre-standing condition. But what about obesity? I am starting today to go on a serious diet and a serious exercise regime, and you'll be able to follow along with my misadventures in that, because for my overall health, I'm too fat and I'm too sedentary, and it's ridiculous, and Kitty's fed up and I'm fed up, and this hopefully will be the time. I've said it before, but this time I mean it. But obesity doesn't really have a direct effect on mortality from COVID-19 disease globally. The reason being, a large number of people that catch this disease are in very economically poor countries or doing very economically poor jobs, and actually are not obese, but they still catch it and they still get hospitalized and they still die from it. So when you add all the numbers together, the effect of obesity that was very noticeable originally actually has now devolved away into statistically not important. I would argue it is. If you are fat and you live in a poor or a rich country, I would argue that your chances of recovery from COVID-19 are much less than somebody who's fit and well going into it. Now that might change, and I've mentioned this before. Spanish flu in 1918 really gave the impression that the young people that died from it was predominantly the young that died from it because of an exaggerated response of their own immune systems to the new virus. The new influenza virus in Spanish flu in 1918. They actually believe they were triggered to have that hyper response by a different type of flu a few years previously. So we may be looking forward in a few years' time to seeing a lot of young people who've gone out partying. Let's blame them. That's not really the main driver of this, and I'll get into that. But who've gone out and got COVID-19, are asymptomatic or have very minor symptoms. They may have set themselves up for death and serious hospitalization if exposed to a similar but different virus within the next year to 3 years. So that's something that we don't know, and I'm just guessing this based upon history. And I think history is very, very important. And I don't think any of us should forget that if you are a prepper, you needed to prep for a pandemic. This is a pandemic. This is a pandemic with a substantial death and illness rate. And if you are still in October 2020 denying it, you've got some issues. You may not be able to cope with any SHTF with that kind of closed attitude. The statistics are crystal clear. What isn't good is most governments' responses to this. I said, I believe in January, definitely in early February, that the only way to stop transmission, and this was before cases in Canada and America, was to close all airlines and all shipping and stop all people moving anywhere out of the areas affected, including all of China. So when it was localized to Wuhan, that was the time to close all movement in and out of China for a period of weeks to let them get their handle on it. We could have sent supplies and personnel in to help, or we should have done, and we should have isolated China, completely and absolutely isolated it. Now Donald Trump did not. He closed down some people coming from China directly 2 days before everybody else did. What he didn't do is he did not stop Americans coming from China, because for some reason that was deemed okay. It was deemed okay by Donald Trump and pretty much every government in the world that their own citizens in infected areas could come out and then be sort of quarantined, etc., etc. And they did it very sloppily. So the countries that have got a handle on COVID-19, the countries that were very repressive, what they did was they slammed shut their borders, they slammed shut their economy, they shut everything apart from really critical essential. They basically discouraged anybody from going outside their homes. They did contact tracing on anybody, and mass numbers of contact tracing. And the really successful ones took anybody with a positive result, and an infringement of their civil liberties and against the Constitution, shoved them in hotels and hospitals for the full quarantine period, so they could not cheat. They are in the situation right now of not having hardly any or zero COVID in their communities. Their economies are now pretty much fully open internally, and they're not doing anywhere near as bad in terms of death and economic woe as compared to the other countries or areas that did not do a full and absolute total lockdown. Now what we're having now is, unfortunately, again, a government's doing a partial lockdown response. They don't think their populations can cope with being told in October, like they should be being told, we're going in full lockdown for the next 4 to 6 weeks. Full lockdown. We're going to give welfare, we're going to give supports because we have money for weapons, we can do this. I've argued this before and I'll keep arguing this. There's a ton of money to support people. There is. Okay, we'll pay debt for years and years, but you know what? This is a significant issue, as significant as World War II. But full lockdown is what is required right now. These circuit breakers, the regional response, the tier response that the United Kingdom is going to do, will partially decrease the spread, but will not remove the ongoing pressure from the virus to replicate and cause economic and healthcare crises. You have to be absolutely sure that you can crush transmission from person to person by lockdown. It's the only way that can do it. Now, you can't lock down for the next 5 years. I totally understand that. Though if you think about it, a lot of preppers prep for that in terms of nuclear response, nuclear war response. But you can shut down for 2 to 6 weeks, provided you provide economic help to small businesses, large businesses, because they will also fail, and to individual people, whether they worked before this happened or did not. It's not acceptable to have people starving to death in a rich society. So you have a situation where the governments did not act, most of the governments of the world did not act appropriately or follow the science or treat it seriously. On top of that, a lot of the national healthcare services, a lot of the federal and state healthcare people looked at this as SARS 2003. They treated it as a contact disease. They refused to see it as an airborne disease, and that was the critical failure. And masks prevent and reduce airborne droplet spread if everybody's wearing them. And that's why we have all of these mask policies now. Way too late. But the problem with the mask policies is the masks we've issued the population and our healthcare population with are insufficient. Medical grade masks help. Surgical masks help a bit more. But if you are going to be in a high contact repeated area with members of the public, i.e. human beings, you really ought to have an N95 on. And as I've said before, preferably not a valve N95. I continue to see people wearing a plastic face shield and no mask. That's a really bad idea. It is slightly better than having nothing, but when you are talking about an airborne virus, you really want to stop the transmission. If we crush the transmission by full national lockdown, including border shuttage, because Canada's starting to open its border a bit because people haven't been able to get to their holiday homes. Like, get real, this is a serious event as a world war. That's not really something we should be that upset about. But the thing is, what's going to happen is that people are going to get more and more frustrated. The circuit breakers, the tiered responses, the regional responses that Ontario is doing will not work. I'm saying that with 100% certainty. They will not work. COVID-19 will not go away in the near future. There will continue to be outbreaks. There will continue to be national rises. It will go in peaks and valleys because this is a pandemic and that's what happens. But overall, as you can see, globally, this pandemic is accelerating. And if you look at global infections and global death rates, there is no sign at all that the first wave stopped and the second wave started. Italy's now claiming they're in the third wave. If you look at any pandemic over time, what you'll see is waves. Inside of big and clear waves. Until globally we go down that slope, we're still technically, in my opinion, in the first wave. And I still maintain that you need to do a full lockdown and keep it up. I don't care what the government says. I don't care what Fred blogs on YouTube says that this is just the flu. It isn't. It's killing a significant number of people that catch it. But again, what's your percentage chance of dying from COVID-19 if you catch it? I've crunched a bunch of the numbers. And if you're under the age of 50 and fit and well, and most people are not in our society, but if you are, your chance of dying from this, I've crunched it down to around about 0.4 to 0.5%. If Huples cat makes you a cup of coffee and you drink it, and 199 times out of 200, you'll enjoy that cup of coffee, you'll drink the coffee, right? But say once in 200 times Huples cat puts one of his crafty little medicines in it, and you'll definitely die if you drink the coffee cup. Would you drink 200 cups of coffee knowing that you could die? Would you drink any cup of coffee if you would die? If the chance of death is 1 in 200? Oh, I wouldn't. I don't agree with living in fear. I don't agree with sealing the house and all the rest of it. You can go out shopping safely. You can go to work in most places with reasonable degree of safety. You should have and use your own hand lotion. You should have the best quality mask you can have. You should know how to put it on. You should know how to wear it without touching it and moving it around. And you should know how to take it off carefully and safely and reuse it. The focus on masks now is after the horse has left the barn. I'm pretty sure the founding fathers of the United States of America were not morons. If they were confronted in 2020 with the information they have, they would be doing lockdowns, they would be doing mask policies. They might even take it a bit further and put curfews in place. Now we're starting to see more and more curfews, we're starting to see more and more lockdowns, we're starting to see more and more draconian measures taken against people that decline to follow the rules. And that's what I said in early February as well. Expect that, and expect it to get quite strong. And as a prepper, whether you agree or disagree with the extent of this pandemic or with the rules that are being put in place, don't fight them. There's no point fighting the government. The government's scared. The people working for the government are scared and fed up and frustrated. Imagine how frustrated I am as a hospital administrator in Toronto, working weekend after weekend on nights with full ICU capacity, no issues at all. I'd be feeling great. But what I'm actually working with is ICUs overloaded, ICU patients on stretchers and emerge every single time I work, and not enough staff. And we haven't surged hard. We have surged a little bit. We went from 0 COVID positive for months to around about 5 to 6. The trend is pretty clear. If we get up into the 10 to 12 to 14 range, which we fully expect to do so in the near future, we're going to take draconian measures at my workplace. Much more draconian measures than we did in March and April. There will be compulsory redeployment of staff. There'll be compulsory shift work for those who don't ever do shift work. There's going to be a whole bunch of things. There will also be most surgical shutdowns. There will be a whole bunch of things going on, and we're getting ready to do that right now. So you hear a lot about test and tracing. So obviously China is the best example of this. They had 18 cases of community infection recently, which is the first for months that they've had. So they have shut down a city of 9 million people, and they're going to test all 9 million because they're looking for the asymptomatic carriers. You want to find everybody who has it, whether they have symptoms or not, and isolate them from everybody else for a period of time, whether it's 10 days or 14 days or 28 days, until they are negative and they are no longer able to spread the virus. And it's massively economically difficult, and it's massively socially difficult, and people said at the beginning of this, you can't do that in the West. Why not? Why can't we do that in the West? We have the money for it, we have the social support for it, we have the infrastructure to do that. Do we care so little about people in our society? Are you actually a loser if you catch COVID-19? Are you a loser if you get hospitalized? Are you a loser if you die from this? Are you so unimportant that we don't care to take draconian measures to prevent your death? I hope that People understand that this is not going away soon. It isn't a contrived pandemic. It's an actual pandemic and we need to deal with it. So the governments need to do massive contact tracing. Most of the Western governments have failed to actually even do that. In fact, the United Kingdom, I believe, I hear a figure of £12 billion spent on a system that doesn't work. Ontario quit testing asymptomatic people because we have such a backlog. We did not spend the last 6 months hiring and training people to test COVID-19 swabs, right? We didn't. We didn't increase laboratory capacity significantly. We didn't make more PPE significantly of the right type, the N95. We didn't do social distancing in such a way that it functions for the society and people in it. We have failed. One of the things I heard the other day, and I kind of agree with this, is why are you shutting bars down that have spent a lot of money and effort and are actually doing a lot of processes to stop human-to-human transmission, but you let people flock to Costco? Absolutely valid point. But I'm not on the government. I'm a person. I haven't been to Costco since I believe it was April or May when we made a couple of runs there. Like, I haven't been there. I'm going to very small grocery stores when there's hardly anybody in there, so there's not a lot of virus in the air if people aren't wearing the mask properly, and that's what I'm doing. And I'm also doing food delivery into the house. We worried a lot about contact on the surfaces of stuff. We don't really have to worry about that so much, though they're suggesting it lasts a lot longer than influenza. But basically, a bit of sunlight and leaving it alone for 2 hours, or even 2 days if you're really scared of it, would be enough. And washing your hands before and after opening these packages is just sufficient. We're not bleaching our vegetables, we're not bleaching our packages. Some people are, and again, if you can safely do extra precautions, do them. I just haven't, because I don't see the transmission from that. It's people. When people get together, with or without masks, but specifically without masks, in large numbers, in the open or inside, and make large amounts of noises, either by cheering or clapping or shouting or singing. That's how the massive peaks are rising. But on top of that, we're also seeing renewed human-to-human transmission, probably through grocery stores, probably through bars, probably through gyms. This is going to go on for a long time. So I hope you enjoyed this. I'm going to wind this up because I don't want to make it too long. The governments have to shut down everything in the economy for 2 to 8 weeks. They have to have contact tracing so they can test millions of people over a week and have a system in place to enforce quarantine on those people. And they have to ensure everybody's wearing masks and really focus on getting N95 without valves to all healthcare, police and first responders, including grocery store workers, as fast as they can. They're not doing any of that, hence Jonathan Pye's frustration. A frustration I think we all have.
It's only been a few weeks since head boy and library monitor Rishi Sunak announced that it was time to live without fear, and then unveiled his winter economy plan, which is, to quote the Chancellor, a winter of business failures and job losses. Once again, whilst announcing a plan, they announced that the plan won't work. A theme is emerging.
But don't throw away your personal lockdown, your personal distancing, your personal mask wearing, your personal hand washing, just because this has gone on for a long time and the government's not really handling it very well. It's not about them, it's about you. It's not about what I say on YouTube, it's not about what somebody else says on YouTube, it's you. It's you and your family. Try not to catch this disease, and if you do catch it, do your best not to pass it on to other human beings. That is the right approach for the individual. If all the individuals did this, it doesn't really matter what the government says. And a lot of people are doing this because when the economies open up, like in Florida and Texas, the bars are still getting slammed because people mostly are too smart to go out and eat, because you can avoid doing that. And why would you want to go and go to a restaurant and eat a meal in the middle of a pandemic? Why would you want to go to a cinema and eat a meal in a pandemic? And yes, this will have a massive economic consequence, which we won't really see bite until 2022. So not great news, but there is good news. They're still working on the vaccines. I believe 2 vaccines now are being held because of adverse reactions, and I believe one of the gene modification ones is also being held. I'm not going to go too much into that. There's going to be a lot of focus on that. We need to have full distancing as much as possible most of the time, and some of the times enforced as full lockdowns nationally until such time we have a working and safe vaccine. And we may not get a working and safe vaccine. And if we do, and we probably will, because we're spending a ton of money on this, it probably won't be available to you and me till maybe middle of next year. Or later. Who knows? To be decided. Toodles.
8 months of this shit we've endured for nothing. 8 months of job uncertainty and going